movement first, okay? Because for the palpation, we need to take these tickets out after, because otherwise you get confused for you in the video. So now we do the movement. So for the extra couplet one, we ask to look up and out. So patient here include like this. Not with the head, has to cannot move the head. Yes, this one. And so is that moving the eyes up and out.
If somebody can do that in one movement, then there's something wrong.
We can be crazy. Usually, headache is the main complaint. Headache or dizziness. Okay? Now, point number 2, again, is not an active movement because not everyone has the ability again to move the air. Maybe some of you here can do it. I cannot do it. So, I will show myself because she has long hair. So, it's like this. You move the air down to stretch the temporalis. Okay? So, the therapist doing the patient. Usually Spain, the main complaint. Number 3, we move in front, like this, to stretch the auricularis posterior muscle. Okay? Extra collo is the external rotation. So the patient's here, has to on this. The other side. Look the difference. One side, the other, look. So usually it's range of motion, there is no motion of pain. Now, you can ask the patient sometimes if they don't understand external rotation, just tell them, look posterior, behind yourself. And you can ask them also if they look the same amount behind themselves or not. If you want, at the end of the movement, you can force a little bit movement, okay, to reduction. Extra thorax, you need, sorry, to be sitting here now. Yeah. Turn your hand like this, yes. And we do external rotation, one side and the other. So the difference, what is the difference from which we intra? This is extra. Intra is from here up to here. Okay. Now for the next one, cross your arm in front of you. This is external rotation. Bloom. One side and the other. Extra pelvis standing up. For the camera, it's better like this. So, the patient look in front of you, look at you, stabilize the shoulder, and ask to move the hip. Keep looking at myself, move the hip one side to the other. To see if there is any movement. You can see on her that this side move much more than the other. And she compensates the shoulder. Usually the main complaint is pain, okay? Sit here. External rotation is like this one. It's a modification of the, Faber test is a test for the sacral joint. It's a modification of the test. It's very functional because the patient does this a lot with the shoes, to sit, okay? And you have to look for compensation. Most of the time the patient do like this. Move the trunk in front, or they help themselves. They should do possibly without any help. Okay.
And you also look how high the knee is.
Exactly, or how high the knee, and also not only this, but also how they do it. Because maybe they do like this, but they move the trunk in front to decrease the space, the angle of the so possibly it should be with the back straight and doing this. The first thing you could observe an example like this, and the other one like this, the difference in how much they open, how much they externally rotate. This is the main test for extracostal. We can use something else. If the patient is not able to do it, you can do like passively external rotation. The next one, extra unit, is the same as intra. So it's squatting, lifting the squatting the If the pain is felt in the internal part, you put as intra. If the pain is felt externally, you put as extra. And the going up should be without the help of the hand. You need to go back to the gym. Yes, you need to go back to the gym as well. Okay, no, stay. Just turn around for them to see. Lift your toes like this. No, just no, like this. Like this. No, more. Yes. Now move your foot outwards. Out. Yes, this is extra toes. So we lift the toes and we move outwards. Okay? And mainly pain is felt around the head of the fibula and the lateral malleoli. Now we go to scapula point. Extrascapula is this one. We ask to touch with the hand the thoracic vertebra. So you have to see how far they reach. And also compensation, because this movement has to be done with the external rotation of the shoulder. Like this. If you do it like this is a compensation. Okay? Extrascapular.
Yeah, what is XP?
How we didn't do so. XP is the opening. Not everyone can do it. The contraction of the extensor digitorum brevis, this muscle here. This is why we don't use so much this test, because this is good, but not everyone can do it. Oh, good.
Do the toes have to be lifted, or can it be like flat on the front? Doesn't matter. Okay, just opening the toes.
In some runner, which they have very developed muscle, you could even put resistance like this. We ask them to open. But it's not easy. Especially people that wear a lot of the tight shoes. They lose this ability. Okay? Now, we go back to scapula point. Scapula point, so we touch with one hand the thoracic vertebra. Again, it has to be done in external rotation. Like this, and like this. If the patient does this movement like this, it's not good. This is a compensation. It has to be in external rotation. Possible. This is a very functional movement because it's the movement that we do, for example, to comb your hair, leave something behind. It's very functional, especially for sure. Extrahumerus, next is external rotation. So you can check the external rotation. Yes. And if you want, you can put resistance here. Open. Oh, just strong. Good. You can even barata if you want.
And where's the pain?
Huh?
The pain?
Pain or restriction of motion. Possibly the patient should be with the elbow tucked in the you can even start from internal rotation, go to external. If you want, you can test this way, is the easiest one, or you could test with up 90 degrees abduction. Internal, external. It's the same rotation. One is a little bit abduction, 90 degrees, and one is neutral position. Usually, this is more stronger in shoulder pain. Now we have extracubitus and carpus. Both is supination. From pronation to supination. If you want to do again is resistance, extracubitus you place like here and go. No, go like this. Extra carpi, the resistance is here. Just change where you put the resistance. Thanks. Extra digiti from make the first, this is intra. So it's opening of the hand. If you want, you could put some resistance here. Close. Open. Now the practical part. So we need to put the points. The model for the practical part, no. We need to take out the speakers because otherwise someone has to take out the speakers. So just all the other points. Before it really more hard.